Prevention is critically important to improving outcomes for child health, and in particular in New Zealand. We all know that kids get sick, that kids get injured, that kids get unwell, and we can help them in Starship, but we can do so much more than that by preventing them from getting sick or injured in the first place. And to really deliver prevention in New Zealand, we've got to figure out what works for New Zealanders and for the children and the tamariki of Aotearoa. And so to do that, we've got to research it. We've got to figure out what works for us, what works for our people, and understand that and therefore deliver more effective interventions.
I guess the best place to start is 2003, when the UN released a report that said that New Zealand, or Aotearoa, is the world's third worst place for child deaths related to abusive injuries. We know that the statistics haven't changed since 2003, and what that looks like on the ground is that a child dies in New Zealand every 4 to 5 weeks because somebody has injured them, and they're often in the care of people that they know. So for the last 20 years, health professionals have been receiving independent reports after a significant child death in New Zealand when it's been related to abuse. And time again, the theme of those reports has been that health professionals need to get better at sharing information when they're worried about a child. Part of the Starship Foundation Fellowship is that I do a research project, and I've actually been given enough time and enough space to do a national research project, and it really is trying to place those children at the centre and thinking about how health professionals can share information better to keep future children safe. And so we're analysing the best way possible that we can do that, and construct a really unique system here in Aotearoa. So the other part of my fellowship is working on the front line with children and families. So that's the medical care of children who've been abused or neglected. So ultimately my frontline work and my research work is all focused on trying to keep children in the future safer. We want to reduce that statistic.
Anxiety is one of the most prevalent mental health issues faced by children and young people in New Zealand. Currently about 16,000 young people experience anxiety every year. Children who come into hospital, those who have so-called chronic illnesses, are actually at greater risk of developing anxiety because they experience a number of stresses related to their illness, their treatment. E-therapies involve using technology to deliver health interventions. So that could be through a tablet, through a smartphone, through a laptop. I mean, these days children and young people live in a very technologically based world, much more than the one that I grew up in. And we know for a fact that they're much more comfortable being asked questions and actually receiving help through devices and online. So what we're trying to do with e-therapies is essentially find new ways to help them with mental health issues, using ways in which they're familiar with, that are comfortable for them and in their natural environment as much as possible. Overall, I hope this leads to us being more holistic in our approach to young people's health, so that we don't separate out mental and physical health needs, but we kind of care for both together. I'd love to live in a world where young people feel it's cool to look after their mental health, where they're proud to get help when they need it, and so that they can do all the things that they want to do with their lives.